This meeting is also being recorded, so you might have just heard that. So we'll get started in about 30 seconds or so. Thanks again, and we're really looking forward to an excellent conversation today about what's next for childcare. Thank you everyone for joining today. We're so excited to have you participate in our conversation about childcare in Canada, as well as the investments that are happening globally around the care economy. We're joined today with an incredible set of speakers. So really, if you're interested in what's happening for childcare, you are in the right spot. So what we're going to do is I'm going to go into a bit of housekeeping and share also the context for what is happening right now in the country around childcare. So my name is Anjum Sultana. I'm the National Director of Public Policy and Strategic Communications at YWCA Canada, and my pronouns are she and her. I'm currently calling in from the Toronto, also known as Toronto, which is the traditional territory of many diverse First Nations, Inuit, and Métis communities. It's the traditional territory of the Mississaugas of the Credit, the Haudenosaunee, the Chippewa, the Huron-Wendat, and it's a place that I migrated to by way of Saudi Arabia, and then before that, I was born in India. So that is my own personal migration journey. We do a land acknowledgement at YWCA Canada and many organizations to acknowledge the ongoing impacts and legacy of settler colonialism, and also to ensure that we don't forget our commitments as treaty people when it comes to reconciliation as individuals, as organizations, and as members on this land. And as we engage online, let's also remember that these spaces of connection online are not always safe. We have seen historically and currently how it has been used as a tool of oppression against many marginalized and racialized communities, Black and Indigenous communities, gender and sexual minorities, people living with disabilities, newcomers, immigrants, refugees. And so this is something for us as an organization as a priority, and we invite you to also think about how you can support making these spaces online safer. So today we're here to talk about childcare, and childcare is something that has been a conversation we've been talking about in this country for half a century, 50 years. It's been something that has been a big priority for the feminist movement and other aligned social movements. And it was actually, in fact, in this budget that just passed in April that we saw not only was it the first pandemic budget during during COVID-19 crisis, it was also the first budget that a woman passed as Minister of Finance. So it's no surprise that perhaps this was the budget where we saw unprecedented investment in building a nationwide early learning and childcare system. Since then, and even up until this week, we've seen more and more bilateral agreements around childcare being signed in British Columbia, in Nova Scotia, in Yukon, in Prince Edward Island. We're also hearing Newfoundland and Labrador is imminent, and many others. And this is excellent because this means that that vision of a nationwide childcare system is getting closer and closer to realization. And we're seeing finally, after 50 years of organizing, real hope on the horizon that this will materialize and create better outcomes for families and communities. On the global front, we've also seen massive investments in the global care economy. So at the Generation Equality Forum in France earlier this year, just a couple weeks ago, we saw Prime Minister Justin Trudeau commit $100 million towards the global care economy. And it's the first country to date that has made an investment of this kind. And I'll say, for us at YWCA Canada, it's really special that we're having this conversation today. It is also our 1-year anniversary of work that we published last year in partnership with the Institute for Women in the Economy on a feminist economic recovery plan for Canada. And one of the critical pillars of that work was care work and childcare. So we'll do a bit of reflection on that. What has been the impact of that work and what's next, especially as there may be a federal election on the horizon. So that's what we have going into this conversation. So what's next? That's what we're hoping to talk about today. And I want to now talk a bit about some housekeeping items. So first, in terms of how today is going to go, we've shared a couple of opening remarks. I'll introduce our speakers in just a bit. We're really interested in diving into questions that we have prepared, but also questions that you might have as audience members. So definitely invite you throughout the conversation to ask your questions using the Q&A function, because towards the end, we'll have a bit of a facilitated Q&A. And then we'll wrap up with what's next for us at YWCA Canada to push this conversation forward, but also things that you could do to really make this conversation come alive over the next couple of months, but also especially as we go into a federal election and potentially elections across different provinces and territories. So in terms of recording, so today we're recording this session, and this will be posted on our social media, specifically on our YouTube later today, tomorrow. We'll also send out a link afterwards. So if there's colleagues of yours who did not get a chance to participate in today's session, they'll still get a chance to participate in the conversation after. We've also enabled closed captioning and French interpretation for this event. So for closed captioning, on the lower hand bar, if you click on closed captioning or CC, you should see an option come up to enable. And unfortunately, right now at this moment, that's just for English interpretation, so or English language, but you will be able to see closed captioning as our speakers are sharing. For interpretation, we are doing English to French interpretation, so be sure to click the button towards the end on enabling this feature. En français, nous faisons l'interprétation de anglais vers les français, alors assurez-vous de cliquer sur le bouton pour activer les fonctionnalités. So in French, we mentioned also that there is French interpretation. If you don't click it, you should get whatever language the person is originally speaking in. But if you do want French interpretation in particular, make sure you click that option. As mentioned, we have Q&A. So because we are in webinar only mode, you won't have the best way to engage is through the Q&A function. For tweeting, we're really encouraging you to tweet about this conversation. We have seen when it comes to childcare how essential advocacy is. And a component of advocacy is really engaging online, engaging on social media. So we really encourage you, if you're seeing interesting comments being made, interesting insights, tweet it out, use the hashtag what's next for childcare. And throughout the conversation, we'll also share people's social media handles on Twitter, or speakers' organizations or their personal ones. So feel free to also share what they're saying out there via Twitter as well. And finally, we have an incredible tech team behind the scenes and members of the national office behind the scenes. So if you have any questions at all, feel free to reach out to Kristen and Arissa. They should have tech in their name. They should also be, you should be able to go out and message them directly. So if you have any tech questions at all, be sure to reach out to them. They'll be able to help you out. So with that, let's get started. So really, really happy to have some of the most incredible change agents in the country on childcare with us today, starting with Martha Friendly. When you hear Martha's name, it's synonymous with childcare. So really glad to have her here with us today. And Martha is the Executive Director and founder of Childcare Resource and Research Unit. She's a policy researcher, she's an advocate, she's been doing incredible work on fighting for a universal system for childcare since the 1970s. She is someone whose research I rely on for our advocacy work at YWCA Canada. So really glad to have you with us here today, Martha.
Thank you.
Oh. Amazing. Okay. Thank you.
Good.
Thank you.
Hello.
Hello. Next, we have Amar Najhawan, who is the Women's Rights Policy and Advocacy Specialist. She leads the policy work at Oxfam Canada around economic justice, care, UN Women at the Beijing 25 Plus process. She has done graduate work in gender policy at the London School of Economics. And I've worked recently closely with Amar on some of the advocacy around the care economy, and it's been really great to see her leadership on this file. So glad to have you with us here, Amar.
Thanks, Anjum. Thanks, everyone, for having me.
Amazing. Next, we have Chantel Krish, and I am so glad that this year in particular, I actually had the chance to have conversations and just learn more from Chantel. And she has been a leader in the fight for childcare and has been doing great work in the province of British Columbia, especially. Most recently, she was in the office of the Lieutenant Governor of British Columbia as a Director of Communications. Before that, she was at YWCA Metro Vancouver, and she's someone who really values systems thinking, collaboration, and really glad to have you here with us, Chantel.
Thank you for having me. Oh, there I am. Hi, thank you very much for having me. It's a pleasure to be here.
Amazing. And finally, we have Amy Juschka, who is the YWCA Metro Vancouver's Director of Communications and Advocacy. And I'm so grateful that through our work at YWCA, we got to meet each other, work together, and really inspire each other on our shared vision for a better Canada that's more gender just and gender equitable. So Amy, glad to have you here. And a bit about Amy as well. Before she was at YWCA Metro Vancouver, her career spanned organizations like UNICEF Canada and the David Suzuki Foundation. So yeah, glad to have you here with us, Amy.
Thanks, Anjum. Really great to be here. Hi, everybody.
Amazing. So with that, I want to just dive right into the conversation that we have here today around childcare. It has been a busy 6 weeks when it's come to childcare. So I want to dive right into the conversation. And Chantel, I'm going to go first to you. And the question I have is, so much happening on the childcare front in Canada. Let's start with the big win out west that really started the domino effect for bilateral agreements. And that's the bilateral agreement that the federal government had with the province of British Columbia. Can you tell me a bit, the last number of years you've been fighting for $10 a day childcare in the province of British Columbia. Also as a parent, you've been pushing for this as well. What does this agreement mean for families in the province of British Columbia?
Yeah, thank you so much. And thanks again for having me here. And I just want to acknowledge that I'm joining you from the land of the Coast Salish people here in beautiful Vancouver, the Musqueam, Tsleil-Waututh, and Squamish nations, and very grateful to be able to work on these lands. And it's been an amazing couple of weeks, but it's built on the advocacy and momentum that's taken place over the last 5 decades. And so, for one, I think a big part of what has enabled the ongoing momentum is really just the tireless dedication and determination of advocates across the province. And, the Coalition of Childcare Advocates of British Columbia, I know a number of them are on this attending this session, and I see in the chat they've shared some resources, which is fabulous. Just putting together a coalition of organizations, individuals, advocates, researchers to really help mobilize this work. That's a key function and a key testament to how we've gotten to where we are today. And the development of research, the development of the $10 a day plan that's rooted in evidence, that's rooted in experiences, that's rooted in best practice and what we know as childcare providers, as just people in the community works. So I think that's a huge part of it as well. And being able to leverage that research through effective, consistent, strong, broad communications and advocacy. And so Anjum, when you shared, the importance of advocacy going online, that's a really, that's such a great point, because I think that speaks to the broader piece around advocacy approaches communications. It changes over time. There's so many new ways to communicate with the people we need to reach, and the people we need to reach that aren't necessarily listening or aware or interested in these views. And so one of the things that I think, just speaking personally and on behalf of work I've done previously with YWCA Metro Vancouver, is when we develop campaigns there to mobilize publicly around childcare, we really try to also reach the unlikely allies. So the folks that weren't necessarily believers on universal systems, that or didn't have a lot of the information that we did in a way that was clear and concise. So we would develop campaigns that would preempt some of the questions and the criticisms of universality that we would see. For example, it's too expensive. Building a system would cost so much money and we just can't afford it as a country. And so what we did was we developed a campaign that looked at the economic benefits of childcare, primarily. So what would that mean for British Columbia? What would that mean for our economy? And, we're seeing that kind of alignment with what happened federally in terms of the large historic investment. It's the federal government's main growth strategy. So those kinds of tactics and strategies really helped us to sort of go a little bit above the fold and speak to people and try to influence ideas and decision makers. And I think the other piece around it is ensuring that we keep that momentum going, that we keep the doors open, and that we consistently ensure that we're listening to folks on the ground. And as a mother of 2 little children, I can say that, yeah, it's probably the biggest challenge that I'm sure me and many others like me are facing. And it's so insurmountable that sometimes we don't have the time to actually get up to date on what's going on, because we're really dealing with the day in and day out. So making the communications and the information accessible and simple and easy, that's a really important piece too. And that's something that the 10-a-day plan and the Coalition of Childcare Advocates have done consistently for many, many years. And so we're really grateful for that work here in British Columbia.
And Chantel, just a quick follow-up. I'm curious from your perspective, there's now pushback sometimes where people are like, okay, fine, childcare matters, but then people are like, okay, where should we invest childcare? Why is it important that we invest in nonprofit service providers when it comes to childcare?
That's a great question. And for sure, I mean, it's such a complex issue, and the operationalizing childcare is no small feat, right? But it's been planned out, and there's a roadmap, and there's so much work done into it. And so I think from the research that's been developed, and just from many of us that have worked in organizations that deliver childcare, nonprofit, publicly funded childcare systems really ensure the quality piece. They ensure that they meet the diverse needs of families, right? So not every family is the same. Our relationships with our work and our employers are different. And, nonprofit providers have historically showed up and been there and asked a lot of questions around, what do you need as parents and as communities, and how can we design programs that help us to meet those needs and address those needs. And so I think ensuring inclusive childcare is something that nonprofits have led the way in. For example, speaking again to the YWCA Metro Vancouver, running childcare for teen mothers, for example, so that they can continue to attend school and finish their high school. That's an example of creating a childcare offering that really meets the needs of a unique group, and also ensuring that working families have the services they need. So I think just nonprofit providers have historically been at the forefront of innovation when it comes to childcare. And when you're not profit driven, there's a lot of benefits to that too. And I'll let some of the other speakers weigh in on those points, because there's a lot to say. But yeah, I think it's certainly the leading way. And I think the relationship between governments and nonprofits are designed in such a way that it really puts the best interest of the children, the families, and gender equity at the core.
I'm seeing a lot of head nods, so definitely a lot of agreement there. And so, Amy, I'm going to pass it over to you. As a leader at a nonprofit organization that provides childcare, can you share a bit about, what does this agreement mean for nonprofit childcare providers in such as YWCA Metro Vancouver, this bilateral agreement in BC? And can you share, With the pandemic, what have been some of the challenges and what could this agreement provide to support organizations like the YWCA in Metro Vancouver?
Thanks, Anjum. And I just love listening to Chantel talk about organizations like ours that are delivering great childcare. I should say also I'm joining from as an uninvited guest on the unceded and ancestral lands of the Coast Salish people. And it is such an interesting time for childcare in BC right now. And really, I think significantly, we are transitioning childcare to the Ministry of Education. And that's really important because it means that where possible, childcare is going to be built on school grounds or as part of other public facilities. And it's an important step because we really need to be building childcare the way that we build hospitals or schools, and really make sure that it's part of the public infrastructure. Nonprofit providers, of course, are going to have an important role to play during this transition and after the transition. And Chantel really spoke well to some of the kind of competitive advantage or the benefits of having nonprofit providers. We have the expertise. First of all, organizations like the YWCA have helped build the foundation of childcare across BC. We also can connect families to really important holistic services. And so for our organization, that means things like housing, training, employment, food programs. And so that's going to be really important to support families. As Chantel mentioned, organizations like ours have really important specialized programs, and talked about one of our child care centers, which delivers child care to the kids of teen moms, but also flexible child care. And that's something that we've been hearing a lot about. Parents are engaging in shift work and they need child care that can support them in kind of the hours that they work and really meet the needs of the realities of our labor market. When it comes to what this bilateral agreement means for our province, a really, really important piece of that is how we are supporting the sector, the early childhood educators. And like so many other provinces now, we're really expanding childcare spaces across the province, but those childcare spaces mean nothing if you don't have workers who are filling those spaces. And I think that, really what people need to see is that childcare is a sector that they can work in, that it's a realistic career path for them. And we know that historically, early childhood educators have been undervalued, they've been underpaid. In some places, they make less than $14 an hour. And what that means for the sector is that there is high turnover, there's burnout, and really that then impacts the quality of care that children are receiving. And so a really important piece of our bilateral agreement is a wage grid. And what that means is that it sets out the different levels of pay for people that are in the sector. And so when you're entering it as a career path, you can see that you're going to make this amount of money, and then there's opportunities for growth throughout your career. But in addition to that, what we really need to do is, increase programs. We need to make those programs more accessible. So online and part-time programs to get into this field of work. We need to offer funding and training supports so that people can really quickly enter the childcare sector and be fairly compensated for it.
That's so great. And I really appreciate the focus on workers, because a lot of the time when you hear childcare systems, we also need to think about who is actually going to provide that care in those spots in that system. So yeah, really hearing about the importance of like the wage grid and also the conditions. Is there anything else that you think that people don't think about when it comes to the needs of workers? Anything else that we should be keeping in mind?
Yeah, I mean, I would say that we are a nonprofit childcare provider, and so recruitment and retention has been one of the biggest challenges in operating childcare. And so again, it's these folks need access to paid sick days, they need decent wage, they need opportunities for advancement. And so really, this is all part of building a public system in BC. The way that nurses, doctors, teachers are compensated, we really need to be looking at childcare workers the same way. And the last thing I'll say, Anjum, is that this is a sector that is primarily composed of women. And so we really can see the opportunities of building this sector out and really supporting women.
Absolutely. And especially with the she-cession or just the devastating gendered impact of this crisis, this is a place where there could be jobs, right? Job recovery as well. Now that we've kind of figured out the lay of the land in British Columbia, and British Columbia really started that wave of bilateral agreements this past summer. I want to pass it over to Martha to really start to give us a sense of like what is happening across the country, and it's someone who's been really working in the space. And you also sit on the expert panel for early learning and childcare data and research. I'm wondering, what have you thought about the flurry of bilateral agreements? Nova Scotia, PEI just recently, the Yukon. But then also there was an extension of agreement in Alberta. So what does all this mean? What should we be really keeping our eyes on in this conversation?
It's a great question to put it in context. But first I just want to acknowledge that I'm sitting here in downtown Toronto on the traditional territory of many nations, the Mississauga, the Credit, the Chippewa, the Haudenosaunee, and the Wendat peoples. And it's also the home to many diverse First Nations, Inuit, and Métis people. First of all, you've identified the 4 agreements so far, and the Newfoundland and Labrador agreement is going to be signed this afternoon. So we've got about 4/13, so 5/13 as of this afternoon. And I just want to point out that the agreements are with 3 Liberal governments, 1 NDP, and 1 Conservative government in PEI yesterday, which is really important. Another observation is that the agreements have been coming along really quickly, so it's actually been hard to keep up with them. And they've been coming along much more quickly than the previous round of bilateral agreements that the Trudeau government had been making from. It took about 2 years between 2017 and 2018 for all the provinces to sign on to those, and the Indigenous framework came along even later than that. So the provinces, and I think as a result of the pandemic and all of the work on women's care work and how women fared, the provinces are eager. And so I think that's really important to keep in mind. But it's also really important to realize that it's really too early to know how long it's going to take to move all of the 13 into the yes column. And there is going to be a federal election. They're going to call it, we don't know, but relatively soon. So, I think that the estimation is that before the federal election, there probably will be another, certainly Newfoundland, and maybe 2 others. We're not really sure what that's going to look like. And then there will be a federal election. But what it leaves is the more difficult provinces. So I think that's important to keep in mind, and in the light of the need for advocacy. And so Kenny and Ford and Manitoba and Saskatchewan have been signaling that they're more likely to balk at Ottawa's conditions. And I want to say a few things about Ottawa's conditions. So they still really need to be brought along. I think that's the first thing. But you can now see with these 4, we haven't seen the Newfoundland agreement yet, and we haven't seen the PEI agreement. We've seen the press release and that sort of thing, but they're starting to take shape. And some of the parts are stronger than others, some provinces have a stronger part here and there, because they're not all the same, although there are some parts that are quite consistent. The $10, getting to $10 a day is consistent. The involvement of having a committee that includes the community, very important. In fact, that's verbatim, at least the same in the agreements. But they're all in the right ballpark, and they're actually really quite workable. Sort of going forward. I just want to say that I think we're feeling quite pleased. And I want to credit several things to why they seem to be coming out the way they are. One of them is federal leadership and the use of the federal spending power, which we were absolutely, adamant, really needed to happen. But of course it needed a lot of money. So it is a lot of money. It's enough money to make the federal spending power, pretty salient. I have to credit evidence-based policymaking. The idea that if you're going to do something, there has to be some idea that it's going to do something, it's going to work out. It's a lot of public money, and it should be, and this comes back to the for-profit issue, which I want to say something about before I leave this. You can also really credit the pandemic. I mean, we have to credit the pandemic and the need for economic recovery. And as you said, the idea that childcare has a major, major role in the recovery of the economy. I also think that there have been good negotiations. I mean, you can sort of see that in some of the, in the agreements. I mean, like I feel fairly confident that things are being carried forward, by the federal government, which we're putting a lot of, putting a lot of eggs in that basket, is that they've got some things to say and they're going to put them forward. And not last but not least is great advocacy. And I think this is on all levels. It's on the messages, it's on bringing the research forward, it's on linking the BC childcare advocates to Childcare Now, to the groups in Ontario, the advocacy groups, the unions, the feminist organizations. All of you have been part of this. And I have to say, I've been involved in childcare advocacy for a long time, but this is really good advocacy on all levels. So, and I guess the last thing here on the advocacy thing is that we've passed the stage of why we need to do childcare. I mean, I think we have to still keep our minds on that, but we're at the point of what needs to be done. And that's really, really important. And here I urge you all to look at the Childcare Now national roadmap, which you'll recognize the provincial roadmaps that are starting to emerge, and look at the 10 points about implementation, because those things are really important going forward. Do I still have any time? Because I have a few other things. One last thing that I want to say. It's really important to recognize that this is the beginning to build the system. And it's an enormous victory that we have gotten the idea across, I don't think fully, but laid the groundwork for, we need a system, not a market. When we started saying 10 years ago, we have a childcare market, this doesn't work, the market doesn't work for childcare, I think nobody really knew what we were talking about. Like I wrote some things about it, like really, what does that actually look like? And I think a lot of people have come to, and the market isn't only about for-profit childcare, it's about a whole bunch of other pieces. So I think that a lot of people have kind of gotten their heads around gotten their heads around the fact that you need a childcare system. It doesn't work if it's a business. It doesn't work if you give parents cash, which, is one of the, still one of the themes, is that it's a social policy, it's a public good. And over the next couple of years, as we carry this forward, because this is going to take some time and a lot of effort, we're going to really need to be well-informed and well-organized, and we have to really maintain high expectations for the way we want this to come out. And I feel, I haven't felt as optimistic for a long time about the possibilities, but it's going to be a haul, like we're at the beginning of it. So far, so good, which is important. That's what I think the lay of the land is.
Yeah, that's been really helpful. And I think really that this is just the beginning, right? Like we really have to celebrate this victory, but this is not going to come easy. It's not going to happen overnight, but this is why all of us here and all of us on the call, we need to still be engaged even after the press releases, even after, the announcements.
Now more than ever.
Now more than ever, absolutely. And I think on that note, Amar, I'm really curious to hear from you, kind of looking at this from a global level. Martha talked about the importance of the care economy and childcare for recovery. Certainly that's the case here in Canada. I'm curious if you can make also, some connections around what does this mean globally, especially in light of, the $100 million announcement by Prime Minister Trudeau at the Generation Equality Forum. Why does it matter to invest in childcare globally as well for us here at home?
Thanks, Anjum, and thanks to all the amazing panelists for your contributions so far. I just want to start off by saying I'm joining this group from the unceded traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations in Vancouver. And yeah, similar to how childcare and care systems have been framed within a Canadian context as a sort of critical vehicle for economic recovery, the same same framing, the same problem, the same issues exist globally. So to start off, we were very, very happy to see an investment in the global care economy announced by this government at the Generation Equality Forum last month. This funding really signals that addressing paid and unpaid care is a global issue and the care crisis impacts women all over the world. The cost of inaction is really clear. There will be no global recovery from COVID unless paid and unpaid care are treated as, critical infrastructure issues by societies, by governments, by donors, by foundations at large. The 100 million that was announced at the Generation Equality Forum is actually a part of new international assistance and international development funding that will be used to support programs and initiatives globally that advocate for the rights of care workers, like domestic workers, would continue to sort of create and improve care infrastructure globally, and also to support programs around the world that foster positive social norms around men and women's shared care responsibilities. So really, bridging the gap between international work on care and what it will mean for Canada, it simply means that we will move closer to an equitable economic recovery from COVID globally. Heavy and unequal care responsibilities remain one of the most significant barriers to gender equality worldwide. Globally, even before the pandemic hit, 42% of women of working age said that they were unable to do their paid work because of unpaid care responsibilities at home. That's compared to 6% of men. And currently, women make up 70% of the global healthcare workforce. So, similar to Canada, women and girls' disproportionate care responsibilities have profound consequences for participation in public and political life. Yet, comprehensive care policies actually remain limited in most countries, both in high and low middle income settings alike. UN Women put out this great COVID data response tracker early last year to sort of see how gender equality was factored into the pandemic recovery plans of countries across the world, and showed that only 4% of emergency response measures issued immediately after the pandemic actually addressed paid unpaid care. So, while the pandemic has showed us globally how crucial the provision of care is to just maintaining our everyday life, it continues to be a neglected area in international development and public policy as an area for social and economic transformation. And we can see in the last, 5 to 7 years, funding and interest in women's economic empowerment globally in the international development space has grown more broadly. But what Oxfam research has been saying and showing for the last decade or more is that care needs to be treated as a systemic issue when addressing women's economic empowerment, or these programs and policies aren't going to yield the transformative impact that you want to see. So it's exciting to see that Canada is actually, like you said, the first donor country in the world to set aside money for care in international spending. And we really hope that this investment continues to incentivize other countries to take further action, and also gives Canada a good position to advocate for care and childcare as a part of the pandemic recovery and packages, in international economic policy and decision-making spaces, like the G7. We're still looking for, and we're still advocating for Canada to ratify ILO Convention 189 on protection of decent work for domestic workers, and overall hope that this sort of funding and approach builds the global momentum in support of women's rights and supporting just economic recovery, again on the backs and work of advocates and feminist economists all over the world, specifically in the global South, who've been really, really pushing for this.
Here. Definitely, as you were saying, I saw a lot of head nods, but also, yeah, this is something in every space, locally, provincially, territorially, nationally, and globally. We all need to be talking about care economy because it's essential for the future of our country and our economy, but also for actual high quality way of life, right? Our life needs to be fully supported in all spectrums and all responsibilities that we may hold. So thanks so much, Amar. It's interesting, right? Like all of us here on the Zoom screen, we're clearly very passionate and care a lot about childcare and see the value in investing in it and investing in it publicly. But to be honest, right, not everyone thinks like us, right? Not everyone sees the importance of this public investment. So I have a question for Chantel and Martha to weigh in here. One of the interesting things I've started to see as childcare is starting to ramp up is this discourse of choice. You know, is a nationwide system going to eliminate choice? And so I'm curious, you know, how would you respond to that? And I'll kind of throw in also a historical thing. If you have, you know, any insights on this, you know, we were kind of in a similar position back in 2005, where before that federal election, the Liberal government had signed 10 early learning and childcare system bilateral agreements. Any thoughts on that as well? So first to maybe Martha and then to Chantel.
Well, first of all, that's a great question. And second of all, that time it was actually one of the worst things that happened to me personally, was that cancellation by the Harper government of those 10 agreements as the first act. And so I want to just pick up on there and talk about the concept of choice. First of all, I think you said it re-entered public discourse, but I would think of it as it was put back in public discourse by neoliberal ideologues. It's a neoliberal concept, and it's really been used that way. And I guess I want to say that what it really means is give parents cash in some form, a tax break or a voucher or something like that. And it's the same public money, and don't use the public money to build this, what they paint as a monolithic childcare system, right? I mean, that if it's going to be a childcare system, it's going to be run out of Ottawa, it's going to be run by the unions, and you know, it's going to be no one size fits all. And that is really far from true. But before I say something about that, I want to say that it's completely linked to the idea that childcare is a product. It's a commodity to be bought and sold on the market, like shoes or like candy or something like that, and that it's not a public good or a human right. It's primarily an anti-government idea. It's the idea that solutions to social issues are best decided by individuals by themselves. It's directly derived from Margaret Thatcher's idea that there's no such thing as society, only individuals. And it also treats all forms of what we consider care of children, whether it's regulated or unregulated, profit or nonprofit, quality, not quality, parent or non-parent, not, you know, recognizing that all parents care for the children, even if the children go to childcare, as the same, which of course they're not the same. They're not the same thing, and they have somewhat different purposes. I won't talk about the fact that we already have examples of fulfilling that in Canada. We have the childcare expense deduction. We have, you know, we have these different methods, and as you described, we had the Harper cash benefit, the check that spent about $20 billion in public money over that period of time. And I have never seen, I wrote a piece about this. It was evaluated by the federal government. There was nothing to suggest that it ever improved choice in childcare, which is what it was specifically intended to do. So I think it's a perfect example of really bad social policy. It promotes inequality. It actually, in some cases, it's actually fed the growth of for-profit childcare. It didn't, you know, because it's a commodity, and it's sort of like dog eat dog kind of thing. I think the evidence shows that giving parents cash doesn't provide choice, and that's really what it's code for. I just want to say the Toronto Star had a great editorial about this last year. They quoted, I was going to read the quote, but I won't, Humpty Dumpty and Alice in Wonderland, and they called it a slippery word choice, which I thought was really good. It means anything that you want it to mean. And, you know, I would say that if you look at all the evidence, it shows that how you give parents choice in childcare is by building a responsive, publicly funded system so that it's affordable, so you can build in options like non-standard hours childcare, ensure that there's childcare in communities that are underserved, that aren't profitable, like low-income communities. You need to build a good childcare system that puts all of those pieces into the system so you have equity. What it really means, and again, the Toronto Star was really good on this, said choice, as neoliberals use it, actually mean that parents get less of what they want and need, which is accessible quality childcare, not more. That's what all the evidence shows. So I don't think it's
on that point.
Yeah. It's not going to carry the day, I don't think, in this time around. I think people have been not foolable anymore so much.
Okay, I will also look up that Humpty Dumpty
I'll,
quote in
I'll
that
send it to you.
editorial.
I should have read it actually.
So maybe Chantel, your thoughts on this, like this rhetoric that a nationwide system would limit parent choice.
Yeah, I mean, I think building on a lot of the great points that Martha just made, the choices have to be good. Like I've been personally in a situation where I've had a lot of choices, but none of them were good. So the choice I ended up having to do was the most expensive, which was hiring a full-time caregiver in my home. It was not great for the developmental milestones of my child because it wasn't rooted on all of the evidence that we know helps reduce vulnerability, helps increase social emotional learning, and all of that. And at the end of the day, whenever we found an option that was a licensed facility, which is supposed to be regulated, we knew as parents it was not where we wanted to put our child. And I am not the only person that's had this experience. So there was lots of choices, but the choices were bad choices. So I would say the neoliberal thing that Martha's talking about, absolutely, it's rooted in the idea that, well, we need to leave this in the hands of parents to deal with in their own homes, because we're talking about something really personal. But who ends up suffering is women, is mothers. We're the ones that end up having to take a step back from our careers. Our net worth decreases, our economic participation decreases, as all of the things that you've spoken about and all the great work Ywca Canada is leading around this She session. So again, we now have less choice, right, around what we want to do and how we want to participate in the economy and work. So I actually think the idea of choice is a fallacy. I think it also, without going off on too much of a tangent, it really relates to building an informed public on building on choice, on understanding how our democracy works, on how policy is decided, is designed, on how that's informed by public opinion, how advocacy works, and then working with decision makers to create real true choice. So yeah, I think that the idea of choice is a bit of I kind of shake my head at it because, we talk about equity so much these days, and equity is giving people equal choices, equal opportunities. And that's what this system will do and is doing. So I think now we have choice, but we certainly don't have it as parents and as providers up until now.
Yeah, and I love what you said around, the fallacy of choice, because are there even good choices if we don't actually have the different options that people want? And I think you also picked up on, or you mentioned advocacy and an informed public. And I think this is a good segue to, we've all kind of danced around, there is likely a federal election. There may also be provincial elections and territorial elections. So Amy and Amar, I wanted to, get your thoughts on this. On a federal level, we are in a minority parliament situation. If we do go to the ballot boxes in September or, whenever, what should we be thinking about? And I know both of you at both of your organizations have been leading conversations around feminist recovery. So maybe Amy, first to you, what should we be thinking about locally, nationally, globally?
Thanks, Anjum. I love this big question because, I think, part of this was the work that Ywca Canada has done to really show the way that COVID-19 has, of course, deepened inequities in our society, but also really shifted the way that we think about what are essential services and what is kind of traditionally understood as women's work. And so, this, for us, this is our opportunity. This is our once in a generation, once in a lifetime opportunity to really make sure that we're not returning to the status quo, that we are not, that we're challenging decision makers to really, and our leaders to really dismantle these systems that do not work for us. These are systems that do not reflect the realities of the way that we work. And so, that's, part of this amazing time is really this understanding that the health of our society is so closely tied with the health of our economy and vice versa. And so if we want to have a healthy economy and a healthy recovery, we really have to be investing in our social infrastructure. And from a YWCA perspective, that's really, decent jobs, access to decent work, equal pay for equal work through pay equity legislation, access to sick days, training and reskilling programs for women and for other folks who have been most disproportionately impacted by COVID, really addressing the issue of unpaid care by investing in our care economy. And so what I'm hoping is that we can really hold our leaders accountable in this very special time to dismantle what's not working, to invest in our social infrastructure. We need to be asking our leaders, how are they advancing reconciliation? How are they supporting women? How are they supporting gender equity? How are they investing in social infrastructure and, addressing systemic racism and discrimination? So I hope that we do not go back to the status quo. I hope that we really, really challenge our leaders in this time, and we can do that at all levels of government. So yeah, let's get started.
Awesome. And Amar, from Oxfam Canada's perspective, what is on your kind of radar?
Yeah, well, a lot of the things that Amy so brilliantly put forward, we are really pushing for a feminist recovery that takes in all these ideas into consideration, how we understand women's work, how we understand what essential services are. And, in addition to all the amazing kind of points that Amy just laid out, I think one of the things that we really hope to see is that, the task force on the, national task force on the plan for women in the economy was a huge, signifier that we need this sort of evidence-based research and experts to drive this kind of policy. So I think we really want to make sure to see that this ensures it stays housed in the Department of Finance, and that the recommendations that are taken forward, do take an intersectional approach and work with organizations in service of Black, Indigenous, and racialized women to sort of meaningfully address the impacts of systemic racism, sexism, and economic inequality. This also another kind of point that we want to talk about to sort of get to these policies. We do need to sort of direct the collection of disaggregated data at the federal level, at the provincial level, at the municipal level on the impacts of COVID-19 and on women, on equity-seeking communities, and ensure that a GBA plus analysis is really, really mainstream throughout forthcoming policies that come out. So we want to make sure that strong record is sort of kept and continue. And then from a global perspective, I mean, we really want to make sure that the federal government invests in a global feminist economic recovery in all areas of foreign policy, ranging from assistance to trade to diplomacy to defense, recognizing the disproportionate impact of COVID on women globally, and ensuring that this approach is centered in international assistance and recovery plans. And that also includes putting together a plan to achieve the OECD target of 0.7% of our gross national income going towards development assistance.
That's incredible. And I think, yeah, between yourself and Amy, we have, the rubric for success for how we are going to be evaluating political parties, right? Come this election or another election. And I wonder, the last question kind of want to round off as like a bit of a rapid fire. And it comes from one of our audience members, Nahed. She asked the question, we talk about choice, but if it's a Eurocentric model of childcare, for example, or a care economy, does that actually create choice? So I guess, I'm also curious from this time, right? Pandemics in the past, they've created a lot of legacies for their societies and have shifted the trajectories of their economies. So keeping equity in mind, what do you hope are some of the legacies of this time for childcare or the care economy? Maybe I'll give you folks a second to think, because this is a question that I've kind of cultivated from the audience. Maybe I'll start with Martha. I see you're
well,
interested.
I think it's a great question which is complex. So I do think that there's a mood to embrace diversity of approaches, cultural approaches, certainly with the Indigenous Canadians. They think on the part of the childcare movement, there's a real respect for, for how that's going to work. The issue of since Canada is so multiply diverse, it's a really, really interesting question about how you do that and how you integrate it with, you see, one of the problems is that we have really not achieved even a status quo in childcare that to then start thinking, we have to introduce diversity, diverse points of view on how to, what does that mean in a childcare center and in a meaningful way. I don't think people really have their heads around yet, but understand that it is an important consideration in a funny way. And in fact, it's the YWCA that's brought that up with some of your policies. But what the conclusion is when we're still struggling with what's quality, like you could, there's everything from a really narrow interpretation of what I consider like, the build a better baby, you just do it right and their brains are going to grow, like that whole thing. Very narrow, very American point of view. And then there's, like much more embracing, different cultures, but how do you do that in a diverse situation? I don't think people think it's something that really needs to be tackled, but don't have solutions to yet. But I think we've come a long way. I've heard language that I've never heard before on this about how that needs to be taken into account in building systems. And some of it, by the way, is having democratic participation in the process of building it.
I'll kind of leverage that term that you just used, democratic participation. So maybe, I apologize, it's a very complex question. I'm a complex person, what can I say? So maybe a rapid fire, like a couple of words where you want to see the future of childcare and the future of this country. Maybe Amy, you had this great point about the health of our economy and the health of our society interlinked. Any thoughts for the future of childcare?
I mean, I'm just thinking about what Amar was talking about around representation. And so if we think about how to support such a diverse country with diverse needs, one, representation. So we need to make sure that there's representation, diverse representation at policy tables in all decision making. We have the tools, we know how it needs to be done. There are no excuses not to be using and implementing gender-based analysis plus. And the other piece is, and again from Amar, was disaggregated data. So understanding how individual communities are impacted, what their social needs are, what their health needs are, and really developing policy and funding and programs in ways that support and are realistic for those communities.
That's great. Amar, any additional thoughts that you want to share?
Yeah, just coming in from the global perspective, something that we tried to sort of keep at the top of mind in our messaging for our advocacy is that, care work is more than childcare. It's an umbrella term to describe the range of activities, both paid and unpaid, which are often physically and emotionally demanding, undervalued by society, and unequally distributed. And paid care work, as we know, is no less taxing. Domestic workers face some of the most precarious working conditions and are particularly vulnerable to abuse and exploitation, especially during this pandemic. So I think when we want to talk about, childcare, we have to look at the care economy at whole. We have to look at paid and unpaid care, how these sort of systems, don't prioritize, devalue women, and how we can sort of rebuild or build an economy that centers this work.
Amazing. Thank you. And final word to Chantel.
I would say it has to be inclusive. We have to have the voices and the experiences of communities that, like you said, and like the great question that was talked about was, different people have different ideas of what childcare might mean for them and their families. And so I know here in BC, for example, having Indigenous participation from organizations and communities to design systems that are rooted in the traditional ways of growing and supporting families, that's key. I see the question from Nahed around, new immigrant mothers finding employment and the restrictions there. So one legacy that I would love to see, and what we saw, a big thing that happened was we don't have enough doctors, we don't have enough nurses, we don't have enough healthcare workers, full stop. And so are the rules that we have on bringing new immigrants in and enabling them to work really serving us, and are they fair and equitable? And the answer is they are not. So how do we redesign those systems so that we can build a robust childcare system and care economy that is actually rooted in diversity of thought, ideas, and really leverages the full participation of the people in our country so that we have a growing economy that's sustainable?
Amazing. And I think the perfect note to end on, because we can't have a one size fits all approach. We need it to really work for communities. The labor market needs to work for workers, the childcare systems and social infrastructure needs to work for all of us. So thank you. So with that, and thank you, Nahed, for that great question. With that, I'd like to kind of say thank you to our incredible speakers. What a rich conversation. We covered so many different aspects. And I think this really gave people the foundation to feel confident in entering into childcare conversations. To Chantel's point, we all have a role to play. Democracy matters. Martha, you also talked about democratic participation. And I find, one of the ways to really arm myself into those conversations is to have the information and to understand the issues. And all of you have done that for us today. So thank you so much. So yes, historic investment, but the work does not start. It does not stop. And so for us to really ensure that there's a tangible impact on people's lives post investment, this is the work that all of us in community can do together. So I'll say for us, as one of the leading providers of childcare as a federation, the YWCA, we're really interested in deeply committing to this work, but also holding decision makers to account to really realize that vision of early learning and childcare in the system. So at this point, I'd like to also encourage people, if they're interested in supporting this work to fuel our advocacy, consider donating to many of the organizations represented here. We also will be placing a link in the chat, because this work does not happen by chance, it happens by design. And so we really need to continue to support the advocates in this work. I think the last thing I want to kind of end off as we go in to the end part of this conversation is, in a couple of weeks, YWC Canada, in partnership with YMCA Canada, we're actually releasing a report looking at the impacts of this crisis on young people, because that's another group that has been disproportionately impacted as a group in this crisis. And so we're releasing a report looking at how do we prevent a lockdown generation and how do we invest in young people in post-pandemic recovery. So in a couple of weeks, on August 12th, we'll actually be having an event on International Youth Day. So we really encourage you to come out to that event and read that report. And we really think that this is also an important piece in our recovery conversations, along with a feminist recovery. We also are, once again, incredibly grateful to our incredible panelists and also the audience members for such thoughtful questions. So I want to say a special thank you to the YWC Canada team that made this possible: Ineska Ali, Brian Katz, Erica Yoshida, Hamzia Bawazeba, Kira Tokarev, and of course, our relentless CEO, Maya Roy. And of course, thank you to the stars behind the scenes, our incredible interpreters, Mariette Linda Benoit and Sana El-Khabti, and our tech team, Kristen Stowe and Orissa Merenk. So with that, thank you everyone, and take good care.